Hello, my name is Yelena Baron-Boyam. I'm going to be doing a health history interview on my boyfriend Alex. He will be my patient. First, I need consent from him, so I'm going to introduce myself to him as a nurse practitioner student and ask for consent for this health history interview. Hello, my name is Yelena. I'm a nurse practitioner student. I would like to do a health history interview on you, record this video, upload it to YouTube, and have my professor review and grade it. I need a consent from you. So if you consent, please give me your name and your consent.
Hello, I'm Alex, and I consent to this video to be recorded, uploaded on YouTube for your professor to view and grade.
Okay, perfect. I'm gonna just ask you some questions about, like I said, health history. So it's just an interview, just questions. I'm not gonna touch you or anything. Okay.
Okay.
And then afterwards, like I said, I'm gonna upload it and then send it to my professor on YouTube. Okay.
Okay.
So first, let me ask you some of these basic questions. Like you already gave me your name. So first, let me ask you, how old are you, Alex?
I'm 29 years old.
29. And when is your birthday?
I was born on January 12, 1992.
Okay. Also, I'm going to be taking some notes, just so you know, in case you give me any of the feedback that you give me any answers. If I need to ask you any further detailed questions from that, I will. Okay.
Okay.
So you said that you're 29 years old. Okay.
Yes.
There is gender fluidity choices nowadays, and for a while now. So I would like to ask, what is your gender?
I'm a male.
Okay. And what is your race?
I am of Eastern European Jewish background.
Okay. And may I ask the reason for your background today?
Yes, I'm here for an annual checkup.
Okay.
I'm in perfect health and have never had a medical condition.
That's good. Annual checkups are always very, very important. Let's go over your past medical history. Okay, I'm going to be asking you about if you've had any surgeries, if you've ever been hospitalized, any concerns, if you have any about your past. Do you have any past medical concerns that you wish to convey to me?
No, I feel as though I'm perfectly healthy. I have never had any issues.
Okay. Have you ever had any surgeries?
No,
Have you ever been any hospitalized, been in the ER,
no,
emergency room? No. Have you ever been vaccinated?
yes. I was vaccinated for a lot of stuff when I
Mm-hmm.
was younger, like the chicken pox, measles, polio, tetanus, and other stuff I can quite remember. I also get an annual flu shot. I have not gotten the COVID-19 vaccine yet.
Okay. Any allergies to anything? Medication, food?
No,
No? Okay. Do you take any medications yourself? Do you use any supplements?
I don't use any medications, but I just do daily multivitamins.
Okay. And just to reiterate a little bit on the vaccine, so you said that you've gotten the chickenpox vaccine, the tetanus, the um, polio, you said even, and you also get
Yes,
annual flu shots.
yes,
You haven't gotten the COVID vaccine yet.
no.
Okay, I understand. It's a personal choice, so I definitely understand if you haven't gotten that yet. A lot of people haven't. Let's go over a little bit about your family history. So I'm just going to be asking you a little bit about your father, your mother, your both sets of your grandparents, if you have any siblings. So first and foremost, do you have both of your parents are still alive?
Yes,
Yeah, both sets of grandparents still alive.
yes.
Are they healthy and well? All of them.
My mother has hypertension, which actually runs in the family.
Mm-hmm.
My father has diabetes. My mother's mother has hypertension and diabetes. My mother's father has hypertension. My father's mother has hypertension, diabetes, and has had a stroke. My father's father has had a stroke and has a history of what he says is congestive heart failure.
Okay. So there's quite a bit of hypertension running around in the family. Okay, that's something that we need to monitor with you as well as you get older. Okay.
Okay.
Right now you're 29 years old, you're young and you're probably healthy. Um, but in the future that's something that we need to look out for. Okay.
Okay.
And any children of your own?
No,
No.
not yet.
Any brothers, sisters, pets?
No,
No. Let's go over a little bit about any recreational activities, such as any alcohol.
no,
No, no alcohol whatsoever.
no.
Any caffeine intake.
Yes, yes. However, I drink a cup of coffee a day.
Just one cup of coffee. That's it.
Yes.
Okay. Okay. Do you add any creamer? Do you just drink it black?
I like my coffee black.
Black. Okay. Let's go over a little bit about any drugs that you might partake in. Any recreational drugs, heroin,
No,
methamphetamines. No,
no,
nothing like that. Do you ever take any medications? Do you abuse any? Not abuse, but rather any OxyContin, any
no,
antidepressants, anti-anxiety
no,
medications? No. Okay. Do you smoke tobacco? Do you vape, hookah? Do you marijuana? Smoke marijuana?
no, no,
No.
no. I
Okay.
don't smoke at all.
Okay, that's good. That's good. Let's go over a little bit about your diet and exercise. What does your diet consist of?
I eat relatively well.
Mm-hmm.
Red meat twice a week, fish 3 times a week. I try and eat vegetables every day.
That's good.
I sometimes crave for fast food, so I may have that once a week.
Okay. Fast food once a week is pretty good. So you said red meat twice a week.
Yes,
Fish, you said how many times a week?
three times a
Three
week.
times a week. Okay, and then vegetables you try and eat every day.
Yes.
That's very very good. It's very healthy. So you eat relatively well. That's good. What? How about your exercise? What does your exercise regimen look like?
I work out 5 days out of the week,
Mm-hmm.
and my workout sessions are 1 hour and a half
That's
per
good.
session.
That's good.
I love to work on weight training and some aerobics. Hiking is also really fun, so I give it twice a week.
Okay, that's good. Are you sexually active?
Yes.
Okay. When you're sexually active, do you use any method of contraception?
No.
Like
I,
condoms? No.
no, I don't use condoms.
Is there any reason why you don't use any condoms?
I don't like them.
Okay. Are they itchy? Are they uncomfortable?
Very
The loose
uncomfortable.
sensation. Okay. With that being said, do you get regularly checked for any STDs?
Yes, every year.
That's good. Have you ever had an STD?
No, no, I
No
haven't
STD.
had any
No
STDs.
STDs. Okay. What is your sexual preference?
I'm a straight male.
Okay. Okay. And how many partners have you been sexually active in your entire life?
I had 2 partners.
Okay. How many partners do you have now? Do you have multiple partners?
No.
Okay. Let's go over a little bit about your social history, about your living situation, employment. What is the current living status? Your current living status.
I live at home with my parents.
Mm-hmm. What is your relationship status?
I'm single.
Okay. Are you currently employed?
No, I'm a full-time student.
That's hard. I give you props for that. It's very difficult. I know. I was there. Um, are you a spiritual person, Alex?
Yes, I'm
Mm.
Jewish.
Okay. Do you practice Judaism?
Yes.
Okay. Who or what do you consider a social support system?
My family is my support system.
Okay. Is there any violence, any violence in the house, any violence at work, any personal life, violence in your personal life or anything like that?
Now I feel comfortable at home, at my university, and in my romantic life.
That's good. Do you own any firearms?
No,
No firearms. That's good. Okay. Some people do and some people don't. Again, it's a personal choice. But you don't, you said. Okay.
no,
Um, now, and I would like to ask this because it's very important. Do you ever have any feelings of depression, anxiety, any suicidal ideations?
no.
No? Okay. Now let's go over something that we like to call the review of systems. So I'll just ask you some questions from top to bottom about every every system in the body. Okay, just to make sure that you feel like you're doing well.
Okay.
Okay. Um, so let's go over the general outlook of things. Do you have any new or recent weakness, fatigue, any new onset of any symptoms with your body that you feel kind of strange?
No.
No. How about let's go over your eyes. Any recent vision changes?
No.
No. Let's go over a little bit from your ears. Any ringing in the ears?
No.
Any dizziness?
No.
Okay, how about your nose? Any stuffiness, any congestion, any runny nose,
No.
any new headaches or anything like that?
No.
No. Sore throat?
No.
Okay. Let's go over a little bit about the cardiovascular, so your heart. Have you had any palpitations, something that people like to call a skipped beat?
No.
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 Any chest tightness,
No.
chest pain, anything like that?
No.
Okay. Let's go over a little bit about the respiratory system now. So about your lungs, about your breathing, any new or recent shortness of breath?
No.
No. Any pain when you're taking a deep breath?
No.
Okay. New cough,
No.
mucus buildup anywhere, or rather any phlegm?
No.
No, just like just a bunch of that. You know how in the morning sometimes you wake up and there's just a bunch of that phlegm there. You have to cough it up. Any?
No. No. Not really.
Not really.
Not
Okay.
really. No.
Okay. Let's go over a little bit about your gastrointestinal system. Any stomach or abdominal pain?
No.
Heartburn, nausea,
No.
changes in stool color or size?
No.
Okay. Let's go over the genitourinary system. So, any recent pain urinating?
No.
Any changes on the skin or on the surface of your penis? Any recent or new testicular pain?
No.
Okay. Any pain in the flank area right here that would signal anything with the kidneys?
No.
No. Let's go over a little bit about the musculoskeletal. Any joint pain, back pain, muscle fatigue, muscle tightness, muscle pain? Nothing. Okay,
Nothing.
that's good. Let's talk a little bit about skin, about your pectoral, about the breasts. So any chest tightness, any chest pain, rather, pain in the
No.
chest area? Any new or recent or change in moles that you have, or new ones that have appeared that look a little bit irregular to you, or that are just new in general?
No.
No,
No.
that's
Haven't
good.
noticed.
Okay. Let's go over a little bit of for neurological. Any recent changes in memory, speech, any numbness anywhere in the body?
No.
No. Any recent changes in mood, or have had any suicidal ideation? Something that tells me a little bit about your psyche right now, psychiatric
No.
situation.
No.
Okay. Okay. Any recent bruising, bleeding that for you just seems like it came out of nowhere?
No.
No. Okay. Any recent or new onset of sweating, urination, thirst?
No.
No. I noticed that you said that your parents or your family rather has a history of diabetes, so that's something to look out for. Any new onset of like excessive thirst and urination? Okay.
Okay.
Any new allergies?
No.
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 Any lymph nodes in your neck or anywhere else that are swollen randomly or anything like that?
No.
No. Okay. Recent sunburn?
No. No.
No. Okay. Definitely, when you're out in the sun, definitely wear some SPF 50 at the most. You don't need anything more.
Thank you.
Okay. Do you have any changes about, or rather, do you have any questions about anything that we just went over?
No. No.
Okay.
Everything is clear.
Okay, good. Okay, well, that just finishes up our interview. Okay.
Okay. Thank you so much.
You're welcome.